A clicking or popping sensation inside the shoulder or knee can be normal and not necessarily a sign of something bad going on. But how can you tell if it could be a sign of a more serious problem? In the latest video in my Ask the Doctor series, I'll share my thoughts. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Now, the trick with popping or clicking inside, say, the shoulder or the knee is that there's not an absolute this is always not a big deal or this is always a bad problem. And that's where you might be a little frustrated with this video. There's a lot of normal causes for popping. You could have a little bit of irritation of a bursa in the shoulder that causes a popping sensation. Wouldn't necessarily be a sign of a big deal. You could have a sort of a popping or sort of a clicking or grinding sensation underneath the kneecap due to maybe slight maltracking of the kneecap or softening the articular cartilage or something like that in the knee. Maybe not such a big deal. Maybe one of the more worrisome symptoms would be a popping sensation that's significantly painful inside the shoulder or the knee, or some other mechanical symptom. In the case of the knee, locking or catching of the knee. Something like that might be a more worrisome sign. The difference is whether it would be, again, an irritation of the bursa or softening of the cartilage or maybe slight maltracking of the patella would be in the knee or the shoulder if it was a meniscus tear where that popping was actually the femur and the tibia sort of catching on the torn part of the meniscus, or in the shoulder, a torn labrum that's catching between the ball and the socket, or the articular cartilage in the knee or the shoulder is actually starting to break down, essentially early arthritis. And that's where alone popping or clicking don't necessarily tell you what it is. That's where, especially if it's painful, would be worthwhile to go see an orthopedic surgeon, get x-rays or even an MRI, depending on the nature of the symptoms and what the specific nature of the injury. Figure out exactly what that source of popping or clicking or grinding actually is. Now, if you have an orthopedic injury and you want to hear about options other than surgery or cortisone shots, click the link in the description under this video. You can fill out the contact form to schedule an appointment. I'd also love to hear your experience with your injury. Leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video like I did here. Make sure to subscribe to my channel to be notified when I release a new video and when I start my Ask Dr. Geier live streams. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.